meeting to order. Maria, would you like to do a roll call?
Sure. Stephanie Barish.
Here.
Sheila Montney.
Here.
Lizzie Johnston.
Here.
Kevin McCarthy.
Here.
Nice. Simon. And Matt Lane. Will Scanlon is here on behalf of Matt Lane.
There we go. That's what we're doing.
Then we'll vote to allow that.
Yeah, basically.
All right, so our first order of business today is electing a presiding officer. I was just getting ready to say that. Does anyone want to nominate anybody?
I have to nominate Stephanie Barrett to continue.
I will abstain from that vote. Any other nominations? All right, hearing none. Do you want to do a roll call vote?
Sure we can. You already said you were
I
abstaining.
am abstaining.
Sheila Montney.
Aye.
Lizzie Johnston.
Aye.
Kevin McCarthy.
Aye.
Thank you all. All right. Moving on to the approval of the minutes. Do we need to do these one at a time, or can we do them as a?
You can do all the minutes
All
I
right.
do have an edit.
Okay. Mr. McCarthy?
June. Simply one.
Yes.
So whatever your normal process is,
Mm-hmm.
On the
do we have
agenda.
to vote it in or what's your process?
So you'd make a motion and
To
a
approve.
second
To get it on
to get it on the
Oh, to get
floor,
them on
and
the
then you'd
floor.
have any
I was assuming
corrections.
that.
All right, thanks.
Didn't wanna
You know.
rain on everybody's parade here.
It's abundantly clear, Robert's rules are not my thing, so correct me. So, I understand we
approval.
need, thank you, do we have a second? All right, now we can entertain corrections or comments.
So on the June 23 minutes, it was PDF page 30. Realizing that I left my electronic device sitting on my desk.
Oh.
It's PDF page 30, is that the
It's the last page, yes.
second to last page, I think, or last page?
Starts with commenting on teaching responsibilities.
So what I have printed is only 16 pages, so.
Oh, like the whole package.
Right.
It's the number for the entire.
Oh, I
So in there I was quoting as saying that I apologize, I had it all outlined on my electronic device, which is not working. But it was PDF page 30 as
Where it says,
for years it had insufficient funds, and it says for staff. What I said was programs, not staff.
Okay. And a significant imbalance between the money distributed to programs and the amount dedicated to staff. Funding for some programs, I see what you're saying.
Yeah, so it has me as saying staff, and what I said was programs,
Funding.
which then makes the next sentence actually make sense.
There you go. That was helpful.
It sounded like I was contradicting myself.
Got it.
Thank you.
Yeah, absolutely. And I do have the electronic version, so if you need those for something, feel free. All right, any other corrections or comments? Any discussion? Do you need a motion to vote?
you got your motion.
Okay, so,
Second.
thank you.
Call vote.
All right, do we want to do them by roll call?
Sure, why not? Sheila Montney.
Yes.
Lizzie Johnston.
Aye.
Kevin McCarthy.
Aye.
Stephanie Barish.
Aye.
The vote passes.
Thank you, thank you. The minutes will now be approved and posted, correct? All right. So we have a few items for action, primarily looking to approve some amendments to the bylaws. So if you could reference page 33, there's an amendment to bylaw article 4, section 4, clarifying rules for virtual attendance. So we are proposing to allow virtual attendance for reasons that match the Open Meetings Act reasons, which hopefully then would improve attendance for those that may find themselves unable to be here in person.
I'll make a motion for 4A.
Second.
Thank you very much. Any discussion? All in favor?
Aye.
The motion passes for 4-4. The next amendment is bylaw Article 4, Section 4 about role and selection of alternate delegates. So there's a proposal to allow for delegates to be sent to the meeting if one of the members is unable to attend. However, the current recommendation is that those people would be allowed to attend and speak and take in information but not vote.
Motion for 4B.
Do I have a second?
Second, to get it on the floor. So just to be clear, an alternate cannot vote.
As it is currently written,
We're
that is the
amending that to say
proposal.
that they can vote.
There was nothing specific about a selection of alternates. So this would be establishing a process for alternates, and the matter on the floor is to initially suggest that they would not vote, which is up for discussion.
Okay, and again, forgive me, I didn't bring all my notes with me, or those notes. So this pertains to BHCC.
The FAC.
FAC. That's what I wanted
Correct.
to make sure. Can somebody help me with the rationale for the alternate not voting? This would be.
I can share that
Thank you.
as we were looking and discussing this, we felt like it was the most conservative recommendation and that this group would be able to discuss whether or not allowing a vote would be an option or not.
Okay,
So the concept is open.
okay,
For me, it's concerning
What's
that alternates would not be able to vote.
yeah,
Okay.
If the person selected as the alternate is selected by the person who was appointed,
Mhm.
I feel like they should be able to bestow their rights on that person to make the votes on their behalf.
particularly in such a small and
Yes.
important function as the Fund Advisory Council, I would also support that the alternate be allowed to vote the seat effectively.
Correct.
Voting a seat.
And I would mention that since this is an open meeting, anybody can come and listen and hear the information, so it's not any distinction from any other public body,
Right.
Okay.
a public person. So I think,
So if we're all in agreement, I think the only amendment to this proposal would be to strike the word not.
Which would read alternates may participate in discussion
Which
and, well, maybe instead replace but with and, shall be able.
any other comments, concerns? Do we
So we'll need a motion on the amendment.
motion on the amendment was already out,
I made the motion.
Second.
right?
The
And so
motion.
do we need a motion on the change?
We need to vote on the change and then vote on the changed. I know.
Back on the original. Yeah, you're doing great. So
Maybe
roll call
like
on the amendment right now would be.
All right, so roll call on the amendment itself.
Parliamentarian guide me otherwise.
For the amendment, Stephanie Barish.
Aye.
Sheila Montney.
Aye.
Lizzie Johnston.
Aye.
Kevin McCarthy.
Aye.
The amendment passes.
And now we vote on the amended amendment.
All right,
Original.
so now we vote on the amendment being amended to allow voting to be included, yeah. Correct. Do you want to do it again?
Stephanie Barish.
Aye.
Sheila Montney.
Aye.
Lizzie Johnston.
Aye.
Kevin McCarthy.
Aye.
Will.
And it,
No, now.
not yet. And that motion
passes.
passes as well. Fabulous. And the next one is amendment to Article Bylaw 5 to change minute approval process. Now, yeah, so this is one that we learned that we had to edit when we got here because minute approval cannot be electronic. We tried
One of the
to
chief
smooth
things
it
I was
out.
gonna say is, oh yeah, that works. I don't think that works.
We had tried
actually
to
have to have a
smooth it
meeting.
out, yes.
my
So-
recommendation would be just to strike this
Yes,
and
no motion, no second.
continue to follow OMA requirements and strike this from our agenda.
Cause otherwise it would appear that we would have to have a special meeting just to approve the minutes
Right,
based on
right.
OMA
Yes,
and the 45 days, and so,
yes. Can be burdensome.
right,
So do I need a motion to strike?
No.
Okay, thanks.
we're just taking it off the agenda.
Appreciate it.
No, and so I think that because we aren't necessarily going to have a timely publishing of the minutes, that we make sure that we have the link to YouTube readily available in lieu of minutes until they get over.
Agreed. I will also share that we've discussed making sure that the minutes are approved at the next meeting, whether it's a special meeting or not, rather than
Oh, we have to leave it
approving-
open, Kevin, because it's an open meeting, sorry.
rather than waiting until the annual meeting to approve all of the minutes, so they would be more timely. All right, the next item is to recommend the 2026 budget for criminal justice services related to detention and behavioral health. And Cassie, am I handing that to you?
Second,
Thanks.
It's on the floor now.
we'll get you there.
You're doing great.
Too formal.
Sure, Will Scanlon is here and can assist me with this, but I would draw your attention first to page 35 in your packet, which gives you a summary of the different categories within the mental health and public safety fund. The ask for this year is for a total of $8,310,465. But if we break that down just to the criminal justice portion, which we have as a separate agenda item, the shared sales tax would be supporting, and this starts on page 36. The shared sales tax from the town of Normal would be supporting this portion in the amount of $525,625. So that's a correction on that document on page 6. For the city of Bloomington, the revenue would be $721,025, so $721,025.
What was the town of Normal correct number?
Town of Normal is 525,625.
The numbers are on the previous
So
page.
Yeah, the numbers are
next
in the
page,
summary
it's not
page.
here.
Yeah. And then,
Zeros.
yeah, and then we would be,
I was curious.
yeah, we would be.
One of my line item questions.
We would be using unappropriated fund balance in the amount of $707,347. And that gets you to your grand total that's shown on the summary page of $1,953,997.
I like the original budget better.
Zero, zero, zero.
Zeros.
It's hard to do that with no revenue.
It is.
So then if we move down, we have these budget worksheets are similar to all of our other county budget worksheets that we present for our annual budget. So you'll see that there is a expense lines for salaries. The amount of the salaries is $689,497. Fringe that accompanies that, and then we have supply lines. Supply lines, you'll see several zeros there. We did have an ask for operating expenses. That has been a decrease from the previous year. For vaccines, prescriptions, and non-prescriptions, there was an increase. On the next page, on page 37, there is a ask for mental health services, so those are contract services with our partners. That is an increase in the amount of $620,000. Schooling and conferences, we asked for an increase for a variety of mental health conferences that would support the mental health counselors, counselor recertification and training, suicide risk prevention training or risk assessment training, excuse me, and crisis intervention training.
So can you clarify again, you were on page 37 or you've moved on to a different page?
Nope, I'm still on page 37.
So I think the numbering on the pages on the PDF versus the actual PDF are different
so-
by one.
I know.
Oh,
So the
down
PDF, page
Where's the
one
next
is the
page?
agenda,
I
which is
swiped
not
it
part of
over.
your numbering
Oh,
So
system.
we're no longer on 37 in terms of the electronic version.
So she's
Oh.
talking here about the
Okay.
schooling
Okay.
or the education.
But how are we off on the electronic, cause I can refer to that as the two
So
electronic.
the
We flipped the
number-
page.
your numbering starts page one after
okay.
the agenda,
Yes.
but the PDF numbers page one as the agenda,
Okay,
so you're off by one page.
so it would be 38 on your
Yes.
page.
Correct.
Okay. So I'm still on page 38 and moving down, jail education program is for,
Forgive me just again, so now that I've got the right page up.
Yeah.
So you're moving it from 464 to 620?
for contract mental health services.
And
Yes.
then, okay, and then do you have anything that provides us some grounding as to how much of your current budget you're actually intending to spend during this calendar year to get some idea of like actual expenditure compared to next year versus budgeted compared to next year?
So we intend to spend all of our contracted 464,000. I don't have the actuals, we could probably try to pull those up. I don't know, Kathy, if that would be hard to do right now, but we could try. So the four things,
These are all contracted.
yeah, so the four things that we had contracted for were for the jail psychiatric contract with Carl. We intend to expend all of that. The next was the mental health nurse, and we intend to expend all of that as well. Research services are through Frank Beck. Dr. Beck is with ISU. We expect that he will be billing us for the full amount of his contract. We do have a project through CJCC for $100,000 that will
It's for 2026.
right, we have the same in 2025. So that we anticipate would either be expended or we would carry that over into 2026. They are still, CJCC is still working with law enforcement to see if that would be an updated CIT training through the MTU 8, or if that would be a pilot co-responder model. We've had several ideas put out, but nothing is put into a contract yet.
And again, just continuing to try and get up to speed, I mean, looking at these year over year differences, is that customary that we would see things like schooling and conferences go from 38K this year to 63K next year, and just the size of some of these increases? I guess I can only kind of frame things from my past experience where there would have been maybe a footnote when something is increasing more than 15% or so, more even than just typical inflation, to kind of explain what we're signing off on.
So for your mental health services, I'll go back then. So for your mental health services for 706-002, that's the contract services line. So that has increased because of the increase to our our jail psych contract. That
Is that the Carl
increased,
contract?
that's the Carl contract,
So
so
it's gone up by how much?
I believe, well, dollar amount, I don't have in front of me, but I know that increased it. I think it was at 20 hours a week and it's going to 40 hours a week. And so the contract for 2026 will be $312,000, so almost half of that line.
Expansion, so we're doubling it. Is that need based, scope of services based? What
Need based.
help me to
So
get understand that?
So the rationale for that is,
About 55% of the jail population has a need-based assessment for psychological or psychiatric services. As of today, that number hovers around 165 persons inmates.
Detainees, whatever.
Yeah.
So probably
President.
not trying to
Re-
offend anybody here.
They're detainees. We're definitely in custody.
But that percentage is growing. It wasn't that high even a few years ago.
But the simple act of trying to see those people on a reoccurring basis while they're in custody it necessitates a full-time position.
Gotcha.
And some of the intensity is growing as well.
Yes.
For inmates.
So, and I don't mean to step on you, so if I am, please jump back in. So I had a similar question of what's this for, why the increase? So, so you gave us 4 contracts, are they 26 or we got any contracts?
so the 3 are staying about the same, and the one that increased was the jail site contract for $312,000. So it's $312,000 for Carl. The mental health nurse is $160,000. Research services are $48,000, and the pilot project for the CJCC is $100,000.
That gets you to 615-ish, if my quick in my head was accurate.
Hopefully it's at 620.
So I said ish. I was in my head correct as you were rattling those off, so.
But
I left my calculator hat on my desk too.
But in terms of increases, the other than the site contract, the jail nurse goes up by $10,000 over that time, but the other 2 remain the same.
Okay, and can you give us insight into what Frank Beck is doing for research in the,
Well, there's a couple, 3
because
or
I
4.
haven't been aware of this one.
Okay, there's a couple, 3 or 4 concurrent research projects. One of them, long-term, is just keeping track of the overall jail population and the demographics of that population, not just race and sex and age and offense, but also mental health, use of psychotropic medication and other markers that are being tracked. That's one. We're looking at persons, a cohort of persons who have been detainees at the juvenile detention center, and the factors related to if they return as an adult to the adult facility or they don't return to the adult facility. And we're looking at a recidivism rate for the general population, and then the court has, or the criminal justice system largely has 3 specialty courts, one being a drug court, persons charged with drug offenses who are eligible for probation, persons with a mental health diagnosis who are charged with probationable offenses, and persons who have probationable offenses who are veterans, and those 3 they operate really on the same model. It's just how the cohort is split up in their eligibility.
Without making you do a dissertation here, these are really specific, and thank you for giving me insight, because this is a new one to me, so. Is there something we're trying to understand?
We're trying to understand what programming that we may be offering or we may not be offering that either contributes to a lessening of recidivism, or we should be offering that would contribute to a reduction of recidivism. We're also trying to look at what intervention point in youth that we can start working with the schools or other community groups to lessen juvenile crime overall, and particularly the use of weapons.
Would you be able to talk a little bit about the emerging adult?
Oh, yeah, the state of Illinois, is looking hard at reclassifying or looking at a classification of offenders as emerging adults. So those persons who are 18 to 25 years old, and what services are specific for them, because there's a growing body of research about that group, that whereas people say juvenile brain development in the criminal justice system there's a hard marker at age 18.
Mhm.
You know, now you're an adult and you get treated like an adult. That is probably more toward the age of 23 or 25 developmentally, and how we should gear our services. And McLean County's, and with a couple other jurisdictions, are the pilots for that term of probation and some development of programming through the state administrative office, Illinois courts, to make some determinations about are these appropriate programs and what evaluation should be made of these programs.
I think
And they are just 6 or 12 months old, so we don't have a whole lot of hard data about outcomes. We tend to look at recidivism over a 3 or 5 year period.
I think a lot of the theory that goes into seeking a court like that was really that a lot of the kids that, the theory is that a lot of the kids that are involved in that group did not have supports
Correct.
that that helped them stay out of that and not to be, you know, not to be offenders in that place. And so I will say that the specialty courts are open. People can come see them, and I would encourage you to come watch. They do graduations as well, but it is fascinating to sit in there and to hear how the judges work with people to structure whether it's substance abuse or the veterans, and making sure that they're getting supportive services to get on track and not re-offend. So it's really fascinating. So if you get an opportunity, I'd encourage you to go see the work that's being done and why these specialty courts have shown success.
So to get back to your original question, those are the four main tasks that Frank Beck and the assistants at Stevenson Center are conducting analysis of.
Gotcha. So, appreciate that.
Follow-up question then, the demographics and so forth, since you said this is a period of time, 3 to 4 years, I think you mentioned, to see cause and effect and that sort of thing. Were these statistics already being tracked such
The
that?
jail population was.
So that otherwise, I was just trying to get a handle on, you know, how long is this expected engagement and what can we, you know, expect for future costs if you're saying that the analytical framework for the credibility of the information to be in years.
We would like to have the framework in place to do an evaluation over a 3 to 5 year period, but not necessarily saying that this would be the fund that will pay for it during that time period, but during the initial time period, and to get make sure that the research software is written and then some of the data collection is automated. Now some of the analysis will have to be still contracted out, but we won't have to write code 1, 3, or 4, or 17 more times, depending on the software.
So, software. You want to open that door, Will?
Don't try to.
I'm trying to close the door.
Try to cheer me up.
Yeah. So I assume that Mr. Beck's contract is separate and distinct from software creation.
Correct.
Okay. Just
Correct.
want to make sure I can close
No.
that door
No, it's not.
in this meeting here.
Yeah, no, it's not part of any of those
Excellent.
3 aspects. Talk about it as
I appreciate that
software
answer.
for analysis.
Okay. So I don't know if you had a plan, if you wanted to present all these and have us ask questions, or you don't mind us interrupting budget by budget?
I'm okay with you as we go through the lines, if you want to ask your questions as we go forward.
I think it's easier to follow if we ask them while we're
Budget
there.
by budget, I assume, but I didn't wanna step on the process here, so.
No,
And I'm sorry, Ms. Monty, I interrupted you in the middle of your question. You have other questions.
Oh, I mean, you were very polite, so
Okay.
thank you. No, we're moving on to other items. I had a couple other questions.
Yeah, as do I, but go ahead.
So again, just understanding and the schooling and conferences moving from 38 to 63. Who is this funding for? Who attends the conferences that are being paid for out of these funds?
so the conferences that the schooling and conferences that we've asked for 2026 through the CJCC have a variety of different recipients. So mental health, first aid training for court services would be 18,000 of that ask. Counselor recertification and training is 15,000, and that is the mental health staff in the jail. So your inmate specialists that need recertification, they have certain credentialing that they have to meet in the jail to be a jail counselor, so that would be related to that ask. And then the suicide risk assessment training is for corrections staff. And the CIT training is for law enforcement and first responder staff.
What was the driver of the significant increase?
I think understanding that there were funds available for that training. We did have an increase in the number of inmate specialists that were, we had a vacant position for a while, so we have an increase in the number of counselors. And unfortunately, we've had some incidents in the jail with suicide that they wanted to make sure that they were addressing.
So that's an additional training that hasn't been offered annually.
Correct.
If we look at 36 paper, 37 PDF. So for reference,
Thank you for that.
everybody, sure. Full-time salaries, can you give us insight, is this, well, I don't wanna make assumptions, I'm just asking the question. What are these positions and?
So 12 positions total, 2 inmate specialist positions, and
An innate specialist is,
a mental health counselor in the jail.
thank you.
And then 10 corrections officers.
Okay, and the corrections officers, is their primary duty providing psych services?
No, their primary duty is as a correction officer, but with the building of the new jail annex and the design that was selected to be more responsive to mental health needs required more staffing. So we have a total of 63 COs, and the 10 additional COs that are help to be supported through this fund is for that new model, for the new layout for the annex, where you need more staff. So you need more staff to help nursing staff get back and forth, to pass meds, and then the other duties as required. I don't know if there's anything else you wanna add, Will?
No, I mean, it's I don't know if any of you have had the opportunity to tour the jail,
Oh, the new part.
the new part, yeah. The difference between it and what we refer to as the linear jail, which is the old school. It's not old school, it's in,
Yeah.
that old school, but it just it puts inmates in an environment where they can be grouped together and get their education together, but they're also separated from the linear jail by physical space, and so those you don't have the ability to transfer staff or have any flexibility in staff. They're almost like, I don't want to quite classify it this way, but like they're on different floors. So you're in, but they're in different physical locations in the building with a considerable number of locked doors between them and the linear jail, and just the environment kind of dictates, now that we're gonna open this up and we're gonna run this, to focus on this population and the inmates, or a group of inmates, we're going to need to specialize and get them support and get the appropriate number of staffing, so we're not trading back and forth with staff and shortcutting, having a shortage of staff in the linear jail in order to staff this, or vice versa. So over a course of a 7-day, 24-hour-a-day operation,
That's
Yeah, ten's not a number, it's about 1.5 per, or 2 per shift.
so these 10 are only working in the Coleman index.
You know, you catch these polite.
That's
A
fine,
specialized pod.
that's
Yes.
fine,
Pod.
just wanna make sure I'm using the appropriate terminology.
I don't know what a correctional officer would call it.
Okay. Fair enough.
But they're assigned specifically to build the new model
Correct,
to meet mental health needs.
correct.
Okay.
But they are still correctional.
One question, if you were finished, Kevin.
Yeah. Thank you.
On the next, down below, the vaccine prescription, non-prescription was also one of the large increases, 062.0005. Can you review some of the increases there?
Yeah, so this is all for prescription medication for inmates. It is, we've seen an increase in need. We have an increased amount of individuals that are receiving, so when you have more staff to assess, when you have psychiatrists who can prescribe, then you're gonna see an increase in medications being prescribed. So we have seen that. We've also had an ask from our inmate specialist team to provide psych medication assistance for 1 month post-release. So when they're transitioning out of the jail into the community, and as you can imagine, that's a very disruptive process, trying to get your life back in order in the community, trying to get set up with an appointments and get a job. So they're providing them with medication 1 month post-release. So on days, 1, 2, 3, 4, 5, 6, 7, they are not without medication and they have time to then engage with a community provider to continue with their medication.
I would actually say 30 days is incredibly optimistic.
So that is the ask and why that is increasing.
Is there
So
any,
number of people increasing
Right.
and then offering that 1 month post-release to those individuals. And some of the medications are very pricey.
I know that there's been a shift in some instances of moving from oral to injectables.
Mhm.
And that does increase the price, but it also increases the well, not just the efficacy, but the consistency in having medication in their system, which increases stability. I know that some of the shift has been, the goal has been to reduce the revolving door of coming out and coming back in, and the injectables are a huge part of that. Even to the point where when we thought 30 days was a wonderful increase, some of the medications are now 90-day injectables, which also are more expensive, but stay in the system for 90 days. So,
Which is a much more realistic time frame for getting connected to a physician who would continue.
that's good. I would say that the cost of the 90-day injectable pales in comparison to the cost of the stay in jail.
To be honest, I'm actually surprised that the increase in ask in that line is not much larger.
Well, I think they're looking at this as more of a, see if they can manage it. Population sometimes is a little into the minute, as it were.
Yes, because they do have the option of refusing medication.
So that's,
So that would
did I
be,
take that to mean that that's, the 325 is somewhat anticipatory? Well,
That's a 25.
So,
the 2026 ask is 325,000.
so this is this year, it's 277, and the ask for next year is 325.
Okay,
Which includes a 30-day as described.
okay.
Yes.
Stay away. So we don't know what exactly, well, it's budget amount, but we're anticipating whether people refuse or not refuse,
Refuse.
utilization rates, blah, blah, blah.
And what medication they're taking.
Right. Okay.
And population of the jail fluctuates day to day, so
Yes.
Not all medications are available.
So again, just to kind of continue to educate myself as best as I can, if many of these that are inside as residents today are receiving 90-day injectables, then just that 30-day period, I mean, there are some, I would assume that it's still within the 90 days of when they might have received medication. Was that netted out of this?
Yeah, so these numbers came to us from our mental health nursing staff and our inmate specialist supervisor, Jackie Mathias, who, this was her ask based on the standards that they have in place now.
Are we doing this now
Are we providing medication?
for post, please?
Correct. Well, like she said, so depending on when, if it's an injectable, depending on when you got your injectable, yes. So that depends on the patient and what kind of medication they're on and when they had their last injection.
Mhm.
But the ask specifically for this year was to be able to provide more medication assistance post-release, so that might be also pills.
So I'm trying to imagine, how does this actually work? Just so I get a grasp, so we're giving them medication as they leave? Or they come back here and
Okay.
They have a prescription that they are written by the doctor we contract with that they can take to their pharmacy.
so they're given a prescription? Okay, once
Of
they
the
leave jail.
medication that they're taking.
Okay, an oral form, I guess. I just heard, okay. And so they go get that filled and cost is billed to the program.
Yes.
Okay.
It's a 30-day supply of their medication is called into the pharmacy until the patient can be established with their own physician.
Okay.
Until they can, that sounds like very open-ended.
I think it's important to realize though that we're talking about doubling the amount of psychiatric services, going from 20 hours a week to 40 hours a week. So from my experience, an increased ask of less than $50,000 for doubling psychiatric services is incredibly conservative.
I just wanna make sure, maybe I'm misunderstanding, so this line is specifically for medications, correct?
Correct, but there would be more opportunity for detainees to be assessed by a psychiatric resource and therefore prescribed medication. So since there would be that many more opportunities, I would expect that many more medications.
Oh, yeah, I don't, I'm not discussing.
That's all I'm referencing.
Yeah, no, I'm just trying to understand how this works and if it's new, and if it's new, how does it actually work? Again, I'm new to all this. This is great, this level of detail, we haven't seen this before. As far as I understand, I looked through my last year's materials, we've not seen this level of detail before, so I appreciate getting to see this. So a lot of this is all new. I've never seen it before until a week ago, so lots of questions.
Yes, last year was the first meeting of the FAC, and we remembered that, Member McCarthy, that you had asked for a higher level of detail, so we tried to bring that this year.
I appreciate that.
Any other questions in this section?
I do not.
So that would be the supply section, so
Chief, are we taking these other agenda items, are we voting on them one at a time?
yes, this would be,
This
we
CJ budget?
would be it would be the criminal justice services budget. So that would be the 1.953 million that you'd be voting
Or
on.
we just picked apart?
Yeah, correct. Well,
That part.
do we have a motion?
You do have
So
a
we
motion on the
already
floor.
have-
It's already on the floor,
Should just
good.
call the.
So we just now vote on the amendment.
Yes, ma'am.
So
You got it.
may I just ask a procedural question? At the end of the last meeting, it was brought to my attention that our votes here as participants representing the other funding sources are advisory. So I just kind of wanted to get an understanding of what that means and how I communicate that back to the stakeholders in the city of Bloomington.
So when you are asking about process, you mean, so after it is voted on and approved here, what happened?
No, I'm asking really to understand the materiality of the vote I actually cast, because I think even in the minutes it was reflected and at the last of our meeting, we learned that the decisions really rest with the county and such that we are here representing our two municipalities in more of an advisory capacity. So I just wanted to get clarification on all of that so that I can communicate back effectively to the stakeholders in the city of Bloomington.
So that is correct, so this is an advisory group, so your recommendations, your vote on these budgets would then go through the county's budget process. And so the next step would be to present the recommendations from this group, the Funding Advisory Council, to our executive committee. And they would address that along with the other budgets that they approve for our annual budget.
And just again, I'm gonna be overly simplistic just to try and understand so that I can come with the right understanding and convey that back to the city. So let's say, Member McCarthy and myself, if we were to vote no on something that it really doesn't matter, I guess. Just trying to clarify and connect the dots.
Well, I wouldn't say it doesn't matter. I would say that we would take the recommendation of this council as a whole. So however, if the budget was voted up or down, if it was voted as approved or as not approved, we would take that recommendation to executive to say it was approved by the FAC or it was not recommended by the FAC.
And so as this group had evolved, if we were thinking about this just in a traditional RACI chart, I'm kind of internalizing that the role that I am playing here is more in the consult role as opposed to being responsible or accountable for these decisions. Is that fair? Again, I'm just trying to understand, and ground myself in what the role is.
Sure, so I would say as an advisory board to the full county board, the responsibility of for this fund does rest with the county board, so this is more advisory or consulting.
Thank you.
Ready to vote on the amount of,
It would be the total amount for the criminal justice services recommended through the CJCC, so that would be $1,953,997.
May I ask one more question?
Sure.
So is the town, noticing that just the town of Normal and the city of Bloomington are listed on the revenue side as we get more into these documents, I'm presuming that the county is also a contributor to this budget. Just trying to kind of understand how that all works out together.
And I have the same questions, again, knowing procedurally how you wanted to flow through this, on this top line. So help us to, because nowhere is there a county contribution listed in any of this. This is just, makes it look like the town and the city are funding the mental health aspect, so.
Yeah. So the revenues for the mental health and public safety fund by our intergovernmental agreement have to be accounted for separately in a special fund. They are not commingled with the county funds. This fund is supporting this portion, so the part that you are voting on is only the part that comes from the shared sales tax in our mental health and public safety fund. So the county does have support of mental health initiatives. We have a whole public health department that has mental health initiatives. We have other criminal justice partners that have mental health portions of their budget. But this is only for the shared sales tax that you're voting on. The county funds are not involved with this, so you will not see county revenues in this fund.
So that sparks additional questions. So I appreciate the separateness as required by the special fund. So my presumption is that then the county is not contributing to the special fund.
Correct.
Okay, so in this case, we're looking at a criminal justice services detention and behavioral health. Does this represent the entire budget? The budget we just went through, or about 10?
So the expenses that you have included in here that total $1,953,997 are the asks that we just went through. That is not the entire budget of the jail or the criminal justice partners that make up.
No, and from the questions, my impression that I left from Will's descriptions is this is for the annex and mental health services and correctional officers related to that.
This is just the part that's paid for out of the shared sales tax fund. So we have other nurses that are paid for out of the county's budget. We
Related to
have
mental health.
related to mental health.
So this is not the entire annex budget?
Correct,
No, that is correct.
that's correct.
Okay. So that would be also helpful going forward, just to try to understand not just what Bloomington and Normal, what the entire spend is for this, to try to get a perspective of how this all fits together. Because right now this is great to get another level of transparency, but we're only getting a slice of it. And so from an overall perspective, I appreciate the question. My role, as I understood it from the mayor and my appointee, is fiduciary agent. So it's also to be able to understand kind of how the funding from all of the partners is being appropriately spent, and that I'm asked to vote on, in this case, a narrow view of it. But it would be, I think, appropriate for us to understand the larger picture as it relates to the mental health operations that is covered under the IGA, per your descriptions there.
That makes a lot of sense to me. I think it would be super helpful.
Okay. I understand the ask.
Thank you. And I interrupted you, so I
No,
didn't
no,
mean
not
to
at all.
steal your thunder.
Not at all. Thank you so much.
Yeah, I have other questions. Let's get this one done, and I don't know if you're leaving or not, but
No, I'm staying.
let's get Will's agenda item done.
Okay. Do we wanna do it by roll call?
Sure. For the recommendation for the criminal justice services, portion of the mental health and public safety fund, Stephanie Barish.
Aye.
Sheila Martin,
Yes.
Lizzie Johnston.
Aye.
Will Scanlon,
I have to abstain.
Kevin McCarthy. The motion passes.
I'm here on the sheriff voting on his own personnel, I think I better abstain.
Yeah, that's probably an excellent decision, Will.
Alright, on to the recommendation for the 2026 budget for community behavioral health initiatives.
Marita?
Yes, whichever one.
So I will give the summary and then I will be turning it over to Marita, as she is the
Do you want a
director.
motion in the,
Oh, yep, a motion for 4E.
Second.
Thank you very much. Sorry for jumping the gun there. So in summary, the community behavioral health portion of our budget ask is the largest portion. The total ask is $3,517,344. And I will note where that starts. So I believe that's on page 38 if you have a printed copy, and page 39. Correct. If you have a digital version. I'll turn it over to you.
Absolutely. So for this section of the budget, you can start, of course, with salaries. Compared to 2025, this has gone up mostly as a reflection of the grants program manager that we, that this body did end up making a recommendation for at least a short-term budget amendment, so looking ahead to what next year, that is for the most part what that increase is. Were there any specific questions about the staff line or the salaries line in particular?
That looked to me like a partial person. Has there been other staffing changes that means that expense isn't the full?
More or less, yes. What we were able to do was change 2020. Originally 2026, we had plans for an additional case manager with the FUSE program. So looking at how things were currently looking with the FUSE program and looking at the needs of the department and the momentum that we've been building in getting funds out into the community, we decided to shift that spending, which is why it's not up an entire that whole salary, but it's just a kind of a partial bump up based on a position that we ended up absorbing.
Are there any questions?
Are we doing one by line or?
Whatever you.
I think we can move on to supplies.
Yeah, again, I don't wanna step on presentation.
No, you're good. In the supplies section, our food budget went up slightly. Most of that bump up slightly is planning ahead for snacks, et cetera, at community trainings that we're planning to put on. With a small amount of it being for what I'd say like kind of portable foods for FUSE clients that come in, and if hunger is in the way of appointment being successful, having a couple of different kinds of snacks. So we're not talking like meals or anything like that, because there are plenty of local services in the community that can provide that. So that is accounts for that small bump up of about $550 from the previous year. Books stayed the same. We went down a little bit in our operating and office supplies, and that was just based on trends that we saw from the previous years. So we were glad to be able to bring that down, and our computers under 1,000 also went down a little bit, just based on the number, planning for a new workstation and just based on projected computer end of life cycles for our team. We did not need to plan for as much. The medical and nursing supplies did go up a little bit. We have had one of the things that the FUSE program in particular provides is assistance with medication management. And part of that has been helping to provide different kinds of pill sorters and those kinds of things. So with the increase that we've had in the FUSE program, we increased that a little bit to be able to get different kinds, whether it's twice a day, 4 times a day. We end up needing a good variety of different pill sorters for people to choose from, and as well as dressing supplies, bandages, those kinds of things as well. Cleaning supplies went up slightly, mostly due to the increase in traffic that we see in the office. We went from ending 2023 at 15 and ending 2024 at 30, and we're at 47, maybe 42 clients today. So we've been seeing a lot more in and out in our office because of that. And so just adding some additional supplies so that office staff can keep up and that we can invite clients as well to help kind of increase those life skills as well.
And you're referring to FUSE
Yes,
patients? We have 42 now active.
yes. Let's see, supplies, we did add $1,500 to our building grounds and equipment supply plan. That is specifically for replacing some doorknobs, so that they can lock on the other side, just so that we have a little bit more of a secure environment if we needed to get in and out of those spaces. Copy machine expenses went up based on the trends for cost of ink, so that's about $60 a month. And that is it for supplies before we move on to services. Were there any other questions or thoughts about those sections?
So the number of clients that you're serving, I noticed there was a chart later in our packet that appears to be on that same data point. So I don't know if now would be the right time to ask a related question,
Sure.
or if you would like for me to wait until we get to the.
Either one we can get to, because I mean, certainly the increase in clients is definitely connected to a lot of the differences that we see in the budget, so if you have a specific question, I'd be happy to answer it.
Well, I was just trying to get kind of a grounding in the total impact of this over the program's life cycle. So total number of, I guess I will say, individuals served, recognizing that perhaps some of these are the same individual year to year to year to year. Total number of unique individuals served since its inception in
67,
67.
I believe.
And the total investment supporting those 67 clients over that horizon?
Those 67 clients, at least what I have for 2029 through 2024 would be,
2019.
I'm sorry, yes, 2019 through 2024 would be $1,912,038.43 over that time period. It's comprised about 25 to 30% of the total budget, the total behavioral health coordinating budget from year to year.
Let that settle in my head for a little bit before asking the follow-up question. So 1.9 million over this period, touching 67 people over a 5-year horizon. Thank you.
Follow up on that one over there.
Sure.
So 1.9 through 12/31/24, that's your budget cycle.
That is, yes,
I'm trying to remember.
Calendar year.
I can't keep
Oh,
everything.
yes.
sorry, you're asking
Yes.
what our budget
Yes.
is.
Calendar.
January to December.
Sorry.
Okay, just making sure I don't remember everybody's budget
Yeah.
cycles. So, okay, so we're 8 months deep. So roughly, let's call it 2, just for rounding.
Sure.
So we're assuming we're on the same track with that, so we expect
So far, yes.
somewhere 700,000-800,000 additional, so we're somewhere in the neighborhood.
Yeah, pulling out
2.6, 2.7 million at this point.
Pulling out the fuse costs from the budget is something that takes, there's not a lot of line
And-
items
and-
where, yeah.
I'm not, don't feel pressured to come up with a number here at the table, that's not what is there been material change that we would anticipate those costs would be any different than they've been? Have they
Not
gone up, have they gone down?
substantially, although we are kind of in a phase where we were kind of steady around 10 to like 15 for a couple of years. And now we appear to be hitting another steady point of 35 to 45. I was surprised at the relative stability of the jump between that 10 to 15 to 30 to 45. So we are, I will admit that we are kind of in a learning cycle of that phase. We have not budgeted, based on the trends that we've seen in people joining the program and sometimes rates of attrition if someone moves out of the county or if they choose to no longer be a part of the program or if they end up joining a program that provides similar services. We did plan for some growth throughout the rest of the year, and since we're 8 months in, we have remained kind of within that 35 to kind of 45 range. So we're generally feeling pretty comfortable with so far what we've estimated. Certainly closing out this year, I think will give us a much clearer idea, kind of what that sweet spot is.
What do you attribute that jump, that step change from that 10 to 15 to the numbers that you're seeing now? What do you attribute that to?
Part of it, possibly, we definitely did see an increase in people seeking services, around when, the encampments were broken up, in October of 2024. I think as well, because the program, we get a good combination of referrals from word of mouth from clients. And I think that we've, with the program, really kind of hitting a point of stability over the last couple of years. We, probably about half of our referrals come from the list of people that we know are gonna qualify and that outreach component. And about the other half come from either facility or word of mouth referrals from people to people within circles of, well, you don't have to necessarily be homeless join the Fuse program. A lot of those communities are pretty tightly knit, and if things are going well, they share that they want to make sure that their friends and family are also experiencing something good. So we have been seeing a lot more because of that.
I know that the judges that handle the mental health court called Recovery Court also
We've been in a lot
are
of
making
referrals.
referrals.
Yes, we've been in a lot.
I mean, outside of institutionalization, this is probably the most expensive level of care.
Mhm.
And it is meant to be a step down from an
Mhm.
institution.
Mhm.
And I would say that these are services that without the shared sales tax would not be here. And we would have larger populations rotating through the jail and the ER and consuming resources in other ways that are more expensive. And so I think it's interesting that the other thing that you have worked very hard at, Marita, and even the teams before you, is to build out a program that meets qualifications to be reimbursable by insurance, and therefore this is not a permanent program that we will have. This is a program that in the next 2 years, I believe, is gonna be phasing to another provider and coming off of the expense rolls. But that's something that wouldn't have been able to be done. There was nobody touching this. Chestnut was not gonna touch it. CHS was not gonna touch it. It was just too expensive. I mean, you see the numbers and it's just too expensive for any organization to pick up and to do. So, to help create a program like this, put it onto its feet, make it reimbursable and transfer it out is, I feel like it's a huge step for this population.
Following up on that last one of my questions was, are we Medicaid qualified? And if we're not, are we working on that? Were we?
Yes, we're working on it.
Okay, and so you said 2 years? That's
2 years for CHS. CHS plans to take over in 2027. I don't have a specific date.
There's not a specific takeover plan for, this would be another process, kind of like we did with triage, where we would make this opportunity available to the community and be clear about what kinds of things an organization would need to have in order to continue to make sure that this program is successful, and we would put it out as a competitive opportunity.
There would only be a couple of organizations that
Also
would have the level of.
Also true.
That's what I was gonna say.
Yeah.
Let's be honest, there's only a few people in the community that can do this, right?
Correct.
Okay, just making sure I wasn't fundamentally misunderstanding
no.
views.
Yeah.
Okay.
And what are, you mentioned success measures, what are the success measures
Sure.
for this program?
The main pieces that the Fuse program focuses on is, so there's some, in order to qualify for the Fuse program, you have to demonstrate that you are a frequent user of these systems. So when someone comes to us or when someone gets referred to us, we find out how many of the interactions they've had with the justice system, so arrests, stays at a homeless shelter, and then emergency room visits for mental health or substance use needs. And we look at an 18-month period, and it can be any 18-month period in the last 5 years in McLean County. So these all have to be McLean County interactions. We get that information, and then we continue to track that information while they're in the Fuse program. And we consistently see, I believe that the data should be in that departmental report that is at the end of the report for the Fuse program. But we consistently see a drop in the number of those contacts, which is really exciting. So in that report, through the total number that we have is through start of the program in 2019 through July 2025, out of the 65 total people who have interacted, who have joined the Fuse program, they had 468 interactions across all of those systems total. Since joining Fuse, that's gone down to 148 interactions with those different systems. And the report also does have a breakdown of the nature of those interactions as well, so that you can see that.
It's 46 electronic,
Thank you.
45 paper.
We have also been, it'll probably come up as we get further down into the services section, but we are also contracted with Dr. Frank Beck. And so the advantage that gives us is not only are we able to have Dr. Beck take the data that we've been gathering and kind of help us to analyze it, but we're also able to utilize the data that he's already pulled from the jail. So he has been able, at least so far, to tell us, and we've really just started getting into the rhythm of getting in the good information for him. But for the jail, Fuse clients had 3.43 bookings in the 18 months before they first started, and that goes down to about 1.5 bookings in the jail just in the first 18 months since they started. So right away, with a variety of levels of engagement from people when they just start, because sometimes they get started and we're seeing them every day. Sometimes we're really building that trust and we're seeing them once a day, once a week, once a month. So to still see that decrease across the board so early is really, really heartening.
So you mentioned Dr. Beck again, so he has contracts associated with this side of the budget that we're talking about as well. And are his contracts fully funded by the city of Bloomington and Normal, or is there an apportionment for the county on his contracts as well?
The contract on my end would be something that fully comes from the Mental Health and Public Safety Fund. Any other questions about supplies, and then we can jump right into services, which is a good segue anyway. So in the services section, can someone help me with the page number?
39 paper, 40
Thank you.
electronic.
3
So we went down, we went down by a good amount in the amount of that we expected for advertising and legal notices. We've changed our advertising strategy when it comes to the forum. A lot of that money had previously been set for that, so we really focused on what we would expect the required legal notices for requests for proposals or other things is really what encompasses that portion of the budget. Which brings us to the contract services section. So this section went down by half, but about half of that, it is mostly the same because let's just start. So this section includes the electronic medical record contract for the Fuse program. This is the section that includes Dr. Beck's contract. So we, I want to say it's maybe like $18,000 this year, so we estimated about $20,000 for next year. This also includes the language interpretation services that we use not just for the Fuse program, but we also use just for translation for different documents that we have. And it also includes our copier lease, I believe. This went down by about $40,000 from the last year, but that the other $40,000 that is not in this section, but is in that transfers section way at the bottom, is for our events budget. So this year we're looking to spend probably about $20,000 on the Behavioral Health Forum, and we'd like to plan next year and hopefully in upcoming years to have some sort of outdoor family event in May, to have sort of a resource fair activity that I'd love to be able to kind of rotate, maybe switch parks, have one year be it in a City of Bloomington park, and another year have it in the Town of Normal Park, and so that is part of, but it was also the same, we budgeted $40,000 the previous year for the forum, and we just kind of shifted the way that we want to spend money on the forum so that we can have two events, one that is still open to the community but focuses more on professionals, and another event that really is focusing on members of the community, that we really hope can be a kind of a special thing that our community has, just like the forum. Any questions about that before we hop into mental health services?
Not for me.
Sounds good. So mental health services, more broadly speaking, is mostly anticipating different grant requests, but also includes our budget for our contract with Carl Physician West Group for psychiatric services for the FUSE program. It's a pretty small portion, about $50,000. And the rest of that, about $2,150,000 would be planning for a portion to be spent as competitive, most likely competitive opportunities out in the community. It's pretty close to what the amount that we ended up with this year. We started with the 1.5 million, and then based on the behavioral health urgent care with Center for Human Services being able to sustain themselves independently, we were able to take that planned money and put it back into that, and we ended up at 2.25. So it's fairly close to what we did this year. And it would, based on what we previously talked about what that might mean for emergent funds, we'd be looking at, if we stick within that 10 to 25% set aside for things that might be considered emergent, that would be like 215,000 to like 530,000, between that range.
What is the definition of emergent in the context of what we've been talking about?
Sure, I think that's something we definitely, we built out that meaning for this year, and I did seek this group's help previously in kind of fine tuning what that looks like in our policy. I think that I will most likely continue to look to both BHCC and this group for additional fine tuning of what we might like that to look like in 2026. Generally speaking, across the board, we wanted to expand it beyond literally an emergency, but it would be an opportunity where if something utterly unexpected happened in the community that we hadn't planned for, that someone would be able to apply for that. So if there's some sort of traumatic event locally that happens, having funds available for that, or if there's a law that changes or something like that where we weren't previously able to plan for those kinds of things, that would be, broadly speaking, what this group has previously alluded to being, what they would support as being kind of emergent. I'm looking forward to the grant program manager person that starts on the 8th to really help to be able to spend some dedicated time in clarifying that in collaboration with BHCC and this group.
That person would also be helping to create the RFPs that are identified through the priority strategic plan areas from the mental health action plan too as well.
Yes.
Jump in unless I don't want to step on shitty your questions. Okay. I'll work backwards since we ended on emergent. I had questions on emergent. And so in the minutes on the 23rd, there was a discussion actually on a few different section of our minutes recalling, which I really appreciated having. And Ms. Taylor, your comments that there may arise situations that are universally recognized as emergent needs. However, it's important to have language that differentiates these from issues such as grant shortfalls or other obligations that do not qualify as emergent. I know I agreed with that at that time. And so recently you sent out an email to providers asking essentially, if I interpret this correctly, budget shortfalls and label them as emergent. And so that seems to be somewhat in conflict with our discussion as referenced from these minutes. So I appreciate you asking the question because I'm I'm a little confused as now what we're calling emergent.
Sure.
Because it was fairly clear we were making a point that it shouldn't be about budget shortfalls, but this appears to be asking to fund budget shortfalls.
Sure.
So we certainly need to get some clarity because this seems to be not part of, or not in line with our conversation
Sure.
at the June 23rd meeting.
I think that the primary purpose for establishing an emergent option for this fund was to increase the amount of agility and responsiveness that the fund can apply to. When the difference that I saw that maybe is not valid in what I was previously, when I see as far as grants ending, there's grants ending and then there was grants closing that were not expected to close, or grants ending before they were planned, is kind of the difference that I saw. But if that is still not quite what this body would recommend the use of the funds for, I'd be open to looking at different ways of making the funds a little bit more responsive.
May I share my perspective of the variance, right? So there is a difference between a budget shortfall or a grant shortfall or a grant ending that is a planned ending, right? Emergent fund should not be used for that. And what occurred through the federal administration of holding grant dollars or terminating grants with no notice that were considered necessary for our services and programs to continue to function. That, in my mind, is an emergent need. There is a need to continue services that are deemed important, but funding has been disrupted. And I think that, to me, is the differentiation between what we've said is not included, right? Just a usual shortfall, a grant ending, because it's a planned end, versus funding is lost or disrupted and it's quick and unplanned, and the services are needed to continue to stabilize our community.
Thank you for sharing that, and I appreciate that. Certainly something that I've been rattling around and talking with some of my counterparts about. Without the larger contextual of the discussions I've had to cut to the chase, almost anything then could be put under that definition.
That came into my mind as well. I mean, even a coverage change in
And
an
that was
insurance contract could result in something that one would have expected to have had a source to pay for and then not having a source to pay for.
And so in our discussion, I encourage everybody to read the notes, it was about new programs or new grant opportunities to do new things as the definition, or at least incorporating the definition, the new, rather than the loss of. And I am not going to disagree with you. We can't afford to lose a ton of mental health services here, so there's a line here, right? And I do not take your comments lightly. That's part of my discussion of what about that we can't afford to. But I'm also very leery that effectively almost anything can be under that definition, and we need to be clear that that's not what this is for. It's just say, hey, who needs some cash if your budget's short this year?
Right.
And that can't be
Correct.
what this is for, and I don't think that was anybody's intention with this. But kicking this around and going, okay, what do you think about it? Me stress testing these thoughts among colleagues and other things. That's our pain point here.
Yeah.
I don't have language, but solving funding can't be.
I completely get where you're coming from, and yes, that concept of new, that emerging thing was also part of the language around the emergent needs, so it wasn't just
And clearly our
stopping
conversation was
a
about
bleeding, it was also what's a new need that might come out that there's now an opportunity to build a service. So in terms of the language, is that something that in terms of how the RFP is designed, how the RFPs are scored, how determination of funding can be done to recognize what is a legitimate, right, loss or need versus something, to use your example, a change in insurance fund.
Yeah.
Right?
So I mean, if you don't mind, whatever you're looking at, would you mind to read how this was communicated or share just
You mean the
more of
email?
this? Yeah,
Sure, everybody's fine with that. Sure. I'm preparing a notice of funding, for 2025 emergent behavioral health programs to be released early in September, with one or more awards being approved by October. During our work over the last year, I have generally heard from you that the primary 2025 emergent behavioral health need is ensuring support for services and programs that have unexpectedly lost 2025 funding for services that otherwise do not exist in the community. My intention is to craft the info from this information. And then just instructions for getting in touch. I think he's free to everybody.
BHCC.
BHCC members.
so thank you. And I apologize for not having read that, but I appreciate you sharing that. I mean, it does, cause me to just wonder and reflect on it. I think it was an excellent point. Anything could be included in that.
Sure.
And the spirit of something that is, as it was framed so nicely by you early in the meeting, was truly about, some, black swan, I guess, to use language in other contexts, something completely unexpected that has come to light. That would not just be a change in, I guess, the political climate, for lack of a better word. And then just again, to be able to communicate effectively back to the City of Bloomington when we're talking about emergent need funding, is that exclusive to just City of Bloomington and Town of Normal? Or is there contribution from the county in that fund as well?
I guess I can't speak to utilization of the general fund for those kinds of things. Unlike the Justice Department, the totality of my budget is something that's purely mental health and public safety fund, apart from grants, I suppose, like grant income.
So just to make sure wrapping this up was gonna have the same question is this the totality of it and it's only being used from the mental health and the public safety special fund?
For the specific scope of my department, the functions of my department are entirely covered by the mental health and
So
public
they're
safety fund.
completely being covered by the funds from Bloomington and Normal.
Correct,
The
as per the
county's
IG.
the county's not contributing to this.
May I ask a clarifying question? Would grant revenue that the county has obtained to help support projects be included in this?
It would be not in this specific one, but we do have that a couple
So
of pages.
there are other dollars that are coming into the county to support
Correct.
projects
This
of
is
your
the-
department,
Yes,
but that's not reflected here.
correct. That would describe the system of care grant, which is maybe a page or two down as well. This is here for your review and recommendation.
And any grant shortfalls that other departments within the county are receiving the county would be responsible for those shortfalls. We also have the public health department that has grants that they send out to the community. That is not encompassed here. I'm not sure off the top of my head what the Board of Health has decided for emergent needs, but they manage their own, that board manages that funding of community grants. And I believe
Not
that's
that I
about
want you-
$2 million-ish a year.
Not that I want you to do any kind of a dive, but you just sparked a question, so that's a separate budget from the county budget?
So it's part of the county's budget, but they have a separate board that they have layers as well. So the Board of Health manages the budget of the Public Health Department, and then that goes to the full county board
Okay,
as well.
I was assuming it was some similarity. Making sure I'm understanding. I'll jump in if you, okay. Wanna make sure I'm giving you an opportunity. So a couple of line item questions before I get to the, I'll stay on the 2.2 million. So if I understood you correctly, there's a 50K contract to Carl. roughly. And then the remaining,
The remainder would be for anticipated,
okay, so what are those projects?
those projects have not yet to be determined. Those would be projects that would likely be competitive opportunities utilizing the behavioral health action plan that will be finished and published in October.
So I know last time we had some conversations about the timing of all of this in your budget phase and being now and the desire to do this, but in reflecting on this, so we don't really know,
Correct.
because we don't have a finished plan yet. That's coming before the end of the year,
Yes.
do you like that?
Yep.
If I remember correctly, okay. I thought so. And so, I know some have had ideas, so are we anticipating certain things to come up with? 2.2 million or minus 50,000, whatever the number is, 2.1, whatever you want to call it.
So
Sure.
all but Will have been a part of the BHCC that has been developing the behavioral health action plan. And so those priorities areas, when we were in those discussions, those would be the basis of the RFPs that would be developed to set this in place. So I don't want to forecast the priorities for 2026 before they've been completely adopted. But for example, just a hypothetical, if we wanted to continue with housing for the homeless or
That was
for,
decided to be a priority.
if that was decided to be a priority, then that would be a project that would be included in that 2.2 million, so or 2.150.
Yeah.
So that would be the bucket of money that you could utilize, and then it would be up to Marita and her team to decide how to parse that out.
And the process for deciding that priority is?
The mental health action plan.
So-
I appreciate that, but that's gonna be a whole document, but we can't fund everything in that document.
Sure.
So how are we
there
deciding on
were-
the 26, what's the process for deciding the priorities of projects that we're gonna seek to create an RFP for?
Sure, so something that was discussed in one of the mental health action plan meetings was an opportunity what we've created so far with the behavioral health action plan includes categories that lots of people could choose. We talked a little bit about possibly using it as an opportunity for RFIs to get different ideas from the community that would fit within the constructs that we've created with the behavioral health action plan. I think based on the discussion that BHCC as a group had in a lot of those meetings, getting more of those ideas from the community with the behavioral health action plan as the underpinnings of what those qualifications would be, what kinds of outcomes we would want them to propose as a part of their proposal, appeared to be something that the group was favoring. I would favor something along that line instead of spending probably another 6 months to come up with specific ideas from BHCC, just because it would make sure that we would be able to get that money out sooner. So my intention would be for the grants program manager to kind of confirm what the process would look like, and we would, once the behavioral health action plan is live, so to speak, to utilize that to create most likely some sort of notification of funding opportunity for people to apply to, so that we could have contracts in January or February.
So
Yeah, go ahead, I mean, I've got more questions.
may I ask a follow-up? So last year, and this is more of a procedural question, last year we had the opportunity to kind of look at how that 2 whatever was broken out across the priorities. Would this group be coming back together to do that?
I think there's a reason, especially with the grants program manager starting, I think that it would make a lot of sense to come back to that group for us to kind of formulate an initial idea or a plan of how we might quote unquote sort of tackle that, and if it would make sense to break things out based on maybe the kind of the pillars that we have so far in that plan of which are fairly similar to what we have so far this year, focusing on access, focusing on community engagement, focusing on workforce. So it's possible that maybe there could be a couple of RFPs that are maybe just focusing on those specific opportunities. I do think it would make sense to bring this group back together in the next month or the next couple of months to continue to get feedback about that.
So am I hearing that we're sorting out the process, but your preference would be to the new grant administrator to create the process for deciding on mental health action plan funding priorities?
The mental health action plan priorities in the new behavioral health action plan that we've set are clearer, I think, than we've had before. If it was preferred that BHCC hone in on more specific opportunities, we would be able to do that. It would most likely mean that funds for those priorities are unable to start at the beginning of the year, but that is a direction that we could go.
So we don't have a process for choosing funding priorities at this moment in time?
The
No.
funding priorities exist in the BHCC's revision of the Behavioral Health Action Plan.
Tell me more, help me to understand what that means.
So the strategic planning sessions that we have had allowed us to develop what those funding priorities look like for 2026.
Okay,
It's not yet finalized, so we can't yet share those, but they exist and they've been developed.
so then the mental health action plan is an annual funding prioritization document,
The way that we have built it so
that what
far is
saying?
for most likely an assessment process to begin, but so far it is looking like we will not be utilizing the same process that we did precisely to get those 2025 priorities, where it's like very specific, fairly specific projects. That is something that the HCC could decide to do, but part of the process of changing the behavioral health action plan to look the way that it is so that it could be specific enough to be actionable within that 3-year period, but broad enough to be flexible within that 3-year period.
So use as a launch point to decide on funding priorities, but not instructive as this is what we think they are and
I would
these
agree
three
with
things.
Stephanie that the way that the plan is written is meant to elucidate what those funding priorities should be.
The plan identifies the priorities, but it does not prescribe the
a better
solution
way to
to
put it.
those
That's a good way to put it.
Okay,
allowing for providers to develop projects or opportunities that they feel would meet those priority needs.
so help me to understand, because I'm still fuzzy on the process here, and I'm talking about this last time we talked about emergent funding processes and what we should do, but I haven't seen it defined yet. And clearly we still need to work on the definition of emergent. We've spoken about the evolution of the plan, but I don't know how we get from plan to an RFP. And what we're talking about is saying yes or no to a dollar amount that funds RFPs. And so if I level this up to 10,000 foot view for just a second, is we're being asked for a very specific amount of money. We don't have a plan that identifies it, and we don't have a process for identifying how to get from a plan to an RFP, but we're asking for a specific amount of money. If we have the ability to come back and do budget adjustments through the process, and we're coming back anyway, why aren't we waiting till we see what that has, define the process for getting from plan to RFP, to really get a vision of what our budget need actually is, rather than just say, because this is not intended to be invested in any way, but we're making up a number based on what last year's number was. And we all agree last year's process isn't what we want to do. So why are we following it?
I mean,
I
what
don't
he's saying
understand.
is super resonating with me actually, because, we're talking about priorities, but we aren't talking about the translation of how do you strategically allocate that through a structured process. That seems to be something that maybe needs to be tended.
I would say that we're already shifting in the fact that we've hired a grants program manager. As they're the ones who are supposed to be establishing what the process is and what the management is, monitoring of the outcome. So the change has been, the first step in that change has been made. as far as like putting out the RFPs, what we learned with the Home Sweet Home is that this current staff doesn't have the capacity or the bandwidth to tackle that. Some of it was technical,
Tackle what?
as far as like running a grants.
Grant
program.
administration.
Yes. So
That's what we,
that's part of why we approved this position. Because Home Sweet Home had quite a few hurdles and unfortunate, I would say, delays. And it just took longer than we anticipated, hence the creation of the role that we did at the last meeting. So as far as like, why are we doing the same thing? I don't think that we're doing the same thing, but we are still in transition as to creating the program that you guys are talking about. Like, as far as like creating the proposals and.
to clarify, I'm not suggesting that the process behind the curtain is the same. Obviously, we hired a grant. What I'm saying is what we're doing in this room is exactly the same. Is we're approving a dollar amount before we have any idea what the dollar amount is actually gonna be or what we are gonna spend it on. So effectively, brass tacks, again, not intended to be offensive in any way, we're being asked to write a blank check, we have no idea what it's really gonna go for. It doesn't map back in a way that I can be accountable for
Well,
to, and we can say, there's this document that's coming and we have these areas and it's gonna fund these priorities, but that could really mean anything.
I would say it's not a blank check though. I feel like that's an inappropriate way
Well,
to classify
sorry,
it
a
because.
specific check for $2.1 million with
Well, but
not-
it's not signed and handed over to anybody until the RFPs have been put out, the proposals have been vetted by the BHCC, and then come through the
But you
FAC.
can appreciate what I'm saying, with any board that I've sat on, I can't tell you what I'm gonna spend this money on, but just give me $2 million.
So I would
I would get a
describe
no
it,
vote.
well, but you might say, I want to start an art project, and I don't know who the artists are going to be, but I'm going to have an art project that's worth $2 million. Or I have a training program, I don't know who these specific trainers are going to be, but I know that I'm going to have this much allocated towards that fund. So I think that's, what the mental health action plan is currently. We have an update to that will be coming to drive the decisions for the next 3 years. And we felt like a consistent amount of money allocated towards community projects was appropriate because we know the community is looking to this. And they're
Very much so.
excited about
Very
the
much so.
opportunities for this. And so the difference would be, I think, once we have that behavioral health action plan completed, if you would want to come back to the FAC to say, okay, now we have a better description of how we wanna cut the pie, if you will. I think you could certainly do that. Otherwise, it would be a lot of extra work coming back every time a project was ready.
So that's would be defining, in my view, an extreme end of a spectrum here. So I'm not suggesting that, but you've shared with us in the past, you have a budget amendment process that we could come and you've offered that in other meetings before. And so if you have a process for doing that, and we're going to get together anyway per Ms. Parrish's questions, then this person will be in place, the mental health action plan will be wrapped up. We will have all the pieces in place to do this exact thing. So why push this now? We have a budget process, we have a staff member coming on, and we have a plan. Those are the pieces that we're all talking about are in development. Why not wait till we have that and then approve a number based on a prioritization and a process that's defined and so again, I 100% agree with you, and I think you all know that I've been beating the drum for putting money in programs. I've been a strong proponent for that, and so I want that to happen, and in no way I'm trying to slow this down. But from transparency perspective and the pieces, they're all coming. We have a budget process. Let's use it.
And the person starts just within a few days, it sounds like.
The 18th soon.
I mean, is there any reason why that wouldn't
Can
work,
we do
what he's
2026
suggesting?
budget amendment before 2026?
Well, the budget would be approved in November.
Yeah.
And so you would bring a budget amendment in December.
Yeah.
For the budget that gets approved mid-November. There's nothing that prohibits it. So we could certainly do that.
Yeah.
When do we anticipate the finalization of the new behavioral health action plan?
The new behavioral health action plan should be finalized in October sometime.
Cause we've all been a part of it, we just don't have it available to publicly.
I have not. The meetings have been scheduled and I couldn't attend, so I have not been part of them very often. I think I got to one maybe, unfortunately.
So the recommendation, if I understand you correctly, is to reduce this line item 706,001 to 50,000 for the Carl contract, reducing it by $2,150,000, taking out the community projects.
Yeah, absolutely, cover your contracts, 100%.
I believe it's 706,0002.
Correct, that's right, yes, excuse me.
Oh, you were asking for the line item, sorry.
I think the concerning thing for me is that we want to be able to demonstrate to the community that we have these funds that are earmarked for urgent needs, which by definition, we can't quantify what they are right now because we don't know what they are. And so part of the planning process is to make sure that the community feels assured that the money is available. Is readily available for an emergent process when the county when we have difficulty sometimes arranging meetings and the county has its own process and then we have delays and then the money doesn't get to them. If we're talking about emergent need, this simply is, and money that is not spent is not suddenly like doled out to anybody walking around.
No, and
The government
and
side,
that's
right?
not, hopefully that's not what I was suggesting, but just to be clear, I wasn't suggesting we're just on the side of the road handing out checks. And if that came across the way, I apologize, that was not my intention at all. I think, I certainly agree with you, 100%. And let's not get red tape be the enemy of opportunity. And so I hear you, responsiveness certainly, but I think it's also incumbent upon us to be clear in what this money is used for before it's just put out to the public that, in a nebulous definition to use the example you gave, emergent. And if we're putting out that if you lost money, come see us, that's not what we want to be putting out to the community as ready and available and flexible and responsible. I think we have some work here to define that before we start putting it out as available, and I think that is incumbent upon us. Our definition, or the BHC broader, the universe of BH, not just FAC. And I think that's part of our responsibility is to not create confusion in the marketplace of what this is, and people start going in there and I'm guessing there's some people that are pretty stressed out.
Sure.
And we don't wanna give them hope and go, sorry, that's not what this is for.
Well,
So I appreciate that, but I think we also have some responsibility on the public as well to be crystal clear about what we're up to.
It just would seem like that degree of transparency in how decisions will be made and just the process around that would also build trust so that people all kind of understand the engagement
Right.
approach.
But the RFP process is pretty crystal clear. It's a real specific, you know what you're bidding on. We're in this emergent need where we're trying to do good, but don't wanna.
right, but I think we also need to be clear that that line item is both.
Oh,
It's the
100%.
funds that will
Yeah,
be
it's
available for RFAs and RFPs, but also
Right.
that emergent bucket.
Yeah, 100% agreed. So is this? No, I got lost on Parliament. Do we need to make a amendment proposal to this budget then I would presume?
Yes. That would be the process to ask to
Okay.
amend the budget.
So process to amend this proposal to front to 50,000, I think is what you said, Ms. Taylor. Make sure we're covering contracts. And then come back, your timeframe was December, was that it, Ms. Taylor?
Well, it would be a, an option to come back. You couldn't amend the 2026 budget until it was fully adopted.
Well, that's kind of where I'm going, what's the process here?
It would be,
Nothing's adopted, so I'm not amending a budget.
yeah, so we would be adopting, the county board would be adopting the 2026 budget at their November board meeting, so it'd be the second week of November. And so it would be any time after that, this group could meet to amend that budget, and then we would present it at the next available board meeting for consideration.
So we would have to wait to meet until it had been approved to recommend an amendment.
I think what our, and sorry for jumping in.
This group could meet at any time,
That's true.
but it would not come before the board until December.
Understood. I'm just thinking timeline for us if the behavioral action plan is coming finalized in October, if we could have something
Get working on
shortly
it, get
thereafter,
working on it.
we could meet again.
This group could meet in November and then you could present it in December.
So I'm gonna say, I'm just gonna put this down to amend this line item 0706.002 to $50,000 proposal. And I'm just gonna leave it because I'm not tabling, I'm not doing any of that date certain silliness. And we'll come back at your direction based on your new staff and the plan availability when it's available and you feel you have those resources to cross and go, what are we gonna do? And get cracking. Is that okay? Everybody cool?
That would be the amendment?
Sorry,
Well, you would also, since you're amending your expense line, you'd also want to amend your revenue line to reflect the reduction as well. So I think you could just say your revenues would be reduced by $2,150,000 as well.
okay. What she said.
Okay.
What she said.
Alright, should we bring the amendment to a vote?
Well, you wanna wait.
I was just say, are there any other questions on?
I got a couple, I think, pretty
Oh, that's right. Do we
GR
wanna
stuff,
go
I don't wanna have it dominating.
I just,
Well, there's, to discuss it, we would need a second.
I would be happy to second that.
So my questions on it is that it feels very Spartan to cut it to 50, knowing that we will be putting money out there, not just for emergent needs, but for our actual funding kind of priorities and for many of the concerns that were raised in all the discussion of the shared sales tax, that you don't want to be the parties that are cutting mental health funding out right now of the budget.
So, as someone who just listened to this conversation, that wasn't what I heard at all. I heard that, there's an opportunity to articulate the process which would benefit everyone from a transparency perspective, and it seems that it would also be a benefit to those who ultimately would be recipients of future funding through this process, to know what the process itself is.
I can just say from sitting at the table, when we pass our budget in November, if we see numbers of like $50,000 on mental health, for community mental health, that is not going to go well.
Well, hopefully you'll explain that we're, based on our conversations from a year ago about process and your desire to have us trying to sync with your budget process dates, which I fully appreciate that and don't want to step on that in any way, shape, or form. But we talked about streamlining this process to better map back to the mental health action plan, and we're reformulating a plan to make it more actionable. Is that the term you used? I want to make sure I'm getting the right terms. And so, which I am fully supportive. The former document was not, in my estimation, an actionable document. So we have an opportunity here with everything that's going on, not to cut money, but to define process. And so I think we're starting to frame up what could like an annual process that we go through to say, plan here now. This may look different next year, because if I heard you, 3 to 5 years,
3 years is the,
so we will have it in place. And we will have the process defined. And so then it can coordinate with your budget cycle as of right now. But we're in this unique weird space where those things aren't, and so the year after it should be, and the year after, and then I would suggest, to avoid your concern at your budget meeting, which I hear is legitimate, is that we look at the timing of the mental health action plan update such that it doesn't trump us again, sorry, bad choice of words, mess us up in your budget process again.
I would like to share one concern about the suggested amendment and how it will impact the process of getting services and funds out. As a provider who's been through a number of RFP processes, right, there is a process to the RFP or the RFI being developed, put out, there's a timeline for responses, there's review of those RFPs and RFIs, and then there is the actual plan of getting the dollars out and getting that program off of the ground and started. If we are looking at the likelihood of an actual budget amendment being approved in December, there is absolutely no way that funds are getting out until spring. It's just not.
So let me distinguish something, because maybe I'm misunderstanding something fundamentally, so maybe you guys can help educate me a little bit. So I'm talking about a funding process, not an RFP process. So you guys, your person's starting, mental health action plan is available in October, is what we're talking about? And I assume as part of your process of identifying, we couldn't start an RFP process before any of that happened anyway. So the RFP process can get established, you're just coming us, telling us how much money that is. So the RFP process wouldn't be delayed in any way, shape, or form, because the process for establishing priority is not affected by this vote. So this vote is only about money, not about process for establishing RFPs, unless I misunderstand it.
I guess my assumption was that the county could not put out an RFP or an RFI without funds to support it.
we would not do that.
Well, and you wouldn't until January anyway.
No, you would want the funds to start being spent January 1st.
Okay, so when would your, so in other words, unless I'm misunderstanding, you have to get the mental health action plan, there has to be a process for creating funding priorities, and this person is going to create it. Are we gonna slow that down in any way?
There's a potential for it to be slowed down, so what would, and I think what you've outlined in the future years is exactly what we want to do.
We hope-
So
we
you
hope
and I
to.
are on the same page as far as, that is our hope and that is our desire.
What we're aiming for.
Yes, these first 2 years
Agreed.
were odd
Out of
years.
sorts.
Yeah.
Yes, because last year we were
Agreed.
creating bylaws and
Yep.
redeveloping,
Yep.
and then this year's first year for the 3-year
Yep.
plan.
Yep, agreed.
But what I would have anticipated happening with the grant manager and Marita is that this group is making a recommendation to the board, and it is included in our proposed budget in September, then that is when the work would start to look at what is our potential, like that's when she'd start looking at process, is between September and October.
Mhm.
Then in October, you have your finalized mental behavioral health action plan, I keep calling it the mental health action plan. You'd have your finalized mental health behavioral action plan
The plan.
with your priorities, yes, the plan with your priorities in October. Then that is when that grants person would start in earnest trying to develop any RFPs that would be coming out in the first quarter of 2026. They wouldn't be able to complete an award officially until after those monies were made available January 1. But you could start a lot of the work for that in November and December. If we're not approving funding until December, I do see that there could be a couple month delay, and Stephanie is probably right that the soonest that you would get a funding award through the process would be
April or May, maybe.
March, maybe.
Yeah.
So You'd be delayed a couple months.
So, making sure I understand everything here. So, in that process, the end of the mental health, the
The plan.
finalization of the health action plan, old acronyms die hard. And that there's almost an immediacy of prioritization of the sole discretion of this grant administrator. That there's no time and space, we don't need a month to create that this person's gonna look at the plan and go, this is what they are, this is what the RFPs are. So I'm trying to understand the process, because it almost sounds like by end of October, we have a plan, beginning of November, we have priorities that are available for RFPs. Is that what we anticipate?
The priorities are established.
Yes.
So again, the process to get from priorities in a plan to an RFP, something happens in that space.
Our grant person and Marita will be looking to say, okay, this was the priority, what is included in that scope? What direction do we wanna take with that? Let's get some sample bids of what we think that might be for a dollar amount. Let's put this out for either, so we have no idea what the dollar amount would be, let's put this out for an RFI. And then the community tells us what they want to do to meet that need, and so that's where it's
And then that
almost,
helps develop that RFP.
yeah, and that's almost simpler to say, from a budgeting standpoint, it's you can do it either way. So one way would be, I have this amount of money to go to these priorities, and then we're going to decide how to allocate those funds. And then this FAC group could be utilized to decide how they want to apportion that. The second way would be to say, I'm going to wait and introduce those after I have a full sense of what the costs are, and then write the RFP or something that I already have an understanding of. And so if you piecemeal it out that way, it could be very cumbersome and time consuming.
So just a question on like the procurement process. Let's say back to the scenario where you just put together an RFI to seek broader input. What's the typical lead time that you would give for a respondent for an RFI? And is that built into your code and written into your procurement policy, or is that something that's discretionary?
So for our procurement policy, our purchasing policy requires a minimum of 10 days for any RFI or RFP
Okay,
to be out and available to the public. There is no maximum,
okay,
but for RFIs, we do typically like to leave it out there for about a month so that people have a chance to find the award and respond to the award.
but with appropriate communication and people knowing that it might be coming out for an RFI, then you could truncate that and say the window for you to express your view could be 10 days. Why would it have to be a month?
That does not leave a lot of time for a community partner to develop a plan.
And realize that many of the community partners are also doing full-time work of service provision and program management and administration, and therefore stopping and writing something in a very brief amount of time is a burden.
It is not a recipe for success.
So,
I would say that, just in historical experience, the longer time you can lay an RFP out for the public, the better the amount of responses you receive. And so when you leave a very short period, our minimum of 10 days, you're lucky. There have been times when we've had shorter time periods, even longer time periods, and you only receive one response. So I wouldn't want to shortcut that process in the event that we would miss out on a great opportunity and a community partner.
So I'm just trying to connect the dots that most of the people that would likely be responding to an RFI would be people that would have full knowledge of what's going on. Many of them would have been participating perhaps in the
Not
development of the
necessarily.
mental health action
Not
plan.
necessarily.
There are a lot of providers in town that are not part of the BHCC.
I do think that, if they take a look at what our budget is and like, why would they take time to write it if there's only 50,000 allocated? Because part of that is communicating to them that like, oh, well, we have this money, but we've not earmarked it. You're gonna have to prove to us before we decide to maybe possibly put some money in. I feel like it is going to deter people from seeking, from participating if they don't see the money, and frustration knowing that it is there and could be earmarked and could be shown or demonstrating our intention to spend this money in the community. So that is my perspective of like cutting it to 50,000 can be very detrimental to the process.
Well, I mean, as someone who responds to a lot of RFQs and RFPs across the country, it's rare that there is a line item budget that is easily available to you to kind of know what's there, but that's just been my personal experience, and the experience here in the county, you would know that much better than me.
So I don't know if you're saying we never use RFI, so we don't never go through a process that we could go through without materially slowing it down, but we go the other way that you described, that we just say we have this amount of money and see what we get. So if I understood the RFI process from the technical perspective that you were describing the steps, is that if we're doing that, we would have to do that anyway. So from the end of October,
Either
there would
way,
at least there'd be November, December before that would happen, so they wouldn't go out till January, so they wouldn't get funded till March and April anyway.
And so it would, either way, it would be true that potentially an RFI, a handful of RFIs could go out in October, potentially we get responses then in November. If we get responses in November, the difference would be that RFPs could go out in December, instead of a budget amendment happening in December.
It's a matter of a couple months, but
Yeah.
yes. So,
I was gonna say that it seems like we're kind of,
Yeah. And it is, I'm definitely interested in getting, there's a lot to be said about,
and we're talking 1 year here, we're talking about right now.
yeah,
Ideally, this isn't the discussion next year.
right.
We hope it's not the discussion
Right.
next year.
Yes.
Yes, we did say that last year, fair enough, you're right.
now, to just to clarify though, when you come back in November, then the dollar amount, like let's say the priorities come back and Marita and the grants manager say, okay, we want $2.5 million and here is the line, I want $1 million for this, I want $500,000 for this,
These
I want
things have been
$500,000 for this.
Identified as the highest priorities is,
Yes.
right, so
And
at least we have a
it's just the
framework.
ideas, and that's what you're looking for in November, but that would be the whole kit and caboodle. You're not suggesting that we would come back for every single,
God, no.
okay,
Well, so
No.
okay.
from a practical perspective, we know that the Home Sweet Home project was a long process.
Mhm.
The EMDR, what was that process timeline?
Shorter, I might need Samantha to help me with that actually. Hello. Not 7 months,
We didn't put out the RFP until, it was a very short window for the RFP because we wanted to match
and it was
our
not,
contracts would have to go to county board and
we
some of
were
those things are due 3 weeks in advance from the
not
actual
expecting,
county board date.
it was not a complicated RFP, we were not
Correct.
expecting, yeah.
So I believe the RFP only sat out for 14 days, maybe like 2 weeks.
But from out to signed, how long did that take? A month and a half, 2 months?
2 months max.
And then how long did it take you to write the RFP? A week?
I wrote the EMDR RFP, this was my first time doing so it took me a little longer. I needed Marita's guidance for it because this was my first RFP, which is why we hired a grants person, so I don't have to do it.
Congratulations, sorry.
I wrote another one too, our ABT one, but So it took me a little longer than it probably will take our grants manager to do so. Probably 2 weeks, cause I have other job duties that I couldn't also set aside, and then with having Marita revise it, send it back, revise.
Okay, so for a simple RFP, 2.5 months.
But that could be extended if we end up not having the funds indeed available.
Right, that's what you said, like the simplest RFP under normal circumstances took from RFP to contract signed, still takes 2.5 months.
Correct, but it's also something that's being implemented in the next, month? For the first training,
It's 2 months, yeah. Yeah, oh, for
the
right
first
now,
training
yes,
is less than a month away
Yeah.
and almost full.
Yeah.
I mean, obviously there was a great need for it. The community was very responsive to this. I mean, it was something that needed to move quickly.
Okay.
This was to train 100 providers in a specific therapy style for trauma. And as I said in the county board meeting, it is the most requested type of therapy when someone calls me for like that is what they're looking for. And that's 99 out of 100 they're looking for. So having the flexibility, as the money was already earmarked, they were able to move and get it done. Which is the point, I mean, that's kind of what I was trying to get at is we wanna shorten that time to get the money into the community and be helping people as quickly as possible.
So I'm a little confused, and I'm probably just not following it,
Okay,
so help me.
Yeah.
So earmarked, does that mean that it had been decided on as a priority according to the mental health
Workforce,
action plan, and we had
yes.
decided in advance to create an RFP to do
workforce
that?
training was the priority.
Yes, the priority was created, we came here to FAC and said, based on the information that we have, we're gonna set aside $200,000 of this amount of money for professional development. And we got additional scope of work information from VHCC to include what topics it should be, and from that, my team created an RFP for specific kinds of training.
Okay. So it was,
So this body did not decide the MDR training, but this body did have additional information to say, these are the broad, of this amount of money for professional development, we're gonna set aside this amount of money.
which is your job and your discretion, not ours, and it's not what, I don't think we're
Right.
here for that deep level of detail. And so that was behavioral action plan dependent. Okay, so it was a structured process of identifying a need, and then the training was available.
And we needed the structured process of identifying, we needed a structured process to hone down to needs because of the breadth of the previous mental health action plan.
Well, I don't wanna, I think we've talked this to death. Just so I vote and get through it. It seems like we've got down that seems to be a very short window of time that this might be impacting, that this is only gonna happen one time, hopefully, ideally, right? Like you said, though, we did say that last year, so if we're having the same conversation a year from now, we have to talk about what we're doing that isn't working differentially, because I think that this process is on us, it's all on us. And so if the way we're handling our own process is mucking up, then we have to talk about it, so.
I think the difference this year is the behavioral
Behavioral
health
health.
action plan wasn't complete by the time Rita was required to put together her budget.
So, yeah, and so again, it's crystal balling now, right? Looking forward, now we have to start thinking about 3 years from now, or when do we start it so it's done by June, let's say, or May, or whatever that, so this is the last time we have this discussion. I hope it is.
I anticipate that rewrites, based on the shift from the massive shift from the mental health action plan to the behavioral health action plan, that the next rewrite will be cleaner and clearer and shorter.
Lovely.
Because it really, there was a lot of what is this document supposed to be?
Yeah.
In the transition to something actionable. So I'm hoping that it's more adaptable.
Yes.
And easier to grow and to be a living document. And not have to kind of like question like, what is our purpose here, right? What is our vision here? Because a lot of that work got done in this rewrite. So I do think it will be cleaner
I'm looking
and
forward to that.
faster,
Looking forward to
faster than an
that.
October passage.
Excellent.
So.
Excellent.
Yeah.
Looking forward to that.
Would there be a solution if the budget number for this line was amended to a number that signaled to the community that mental health services were going to be offered or contracts were gonna be offered? It was not nearly the full amount being asked here, or something on the order of $500,000 or some other number. That was a little easier to amend from the county board's perspective. They weren't handed, but it was clearly not the full amount that is anticipated to be spent, but not handing out. I'm gonna use the term, but I don't mean any offense, a blank check to write. Yeah. For community members that think that there's money for a variety of purposes. But would there be a solution where a budgetary number was such that it indicated it allayed the fears of behavioral health office, but still gave the control to the, not control, but it's direction from this council.
But you're bringing up a great question, and then I expressed a little bit on this when we were in discussion about, my hope would be that what's happening here will be communicated in some way effectively to the county board for them to understand we're not, our intention isn't that we got this timing thing and to be more accountable to the mental health action plan and using that as their funding prioritization tool. That's what is up right now, but we're scheduling to come back and fully intending to fund the priorities as being requested, and it's roughly gonna 2.2, 2.5 in that neighborhood, right? So I don't know what that looks like. That's kind of, I think, in your guys' court to communicate that there's a process that's happening here that's separate and unique from a process that happens on the county board.
That would be something that Marita would include when she presents this budget to her oversight committee.
The recommendations, yes, I would work most likely with Stephanie to craft a recommendation that would be presented along with the budget.
Matriculate, I don't know what the committee structure looks like, so forgive me.
And go to the executive committee.
And so that would matriculate to the full board so that they understand that they're gonna be looking at something coming very quickly that says, hey, this is the full Monty, and it maps directly back to the new, improved and actionable plan that's much better and more effective. Is that? Okay.
Yeah,
I would hope that at
yes, the recommendation that we would craft would represent the,
so the board would be fully aware and fully anticipated that in very short order, they're gonna see the whole full Monty, so to speak.
Yeah.
Said, okay, because I think that's, I would hope that
yeah, I would
at a minimum we
would
want.
do our best to make sure that recommendation is appropriately clear about the nature of the recommendation or lack of a recommendation.
Okay.
Just from your comment, I mean, the only,
No, please.
The one thing that I could think of would be, I mean, just kind of likening this to fixed and variable costs in this particular bucket. You mentioned something that sounded like it's a standard repeatable thing that you might be doing every year or something with this requested training, the example that you gave. I mean, are there things that could have been already carved out and articulated for us that represent kind of that fixed expense, standard offerings that you would be providing resources for, agnostic of, this evolution to a more clearly articulated process. So I guess I'm just responding to your comment on what might that look like. That would be an idea that I had.
I think we wanna assuage the persons that have access to the information, that there is going to be money ahead. I mean, you wouldn't have a road project that with $1 saying, don't worry, when we get there, there'll be money there.
I would say from a social service, from somebody that has worked my career in social services, I still struggle with the idea of, but I promise we'll bring it. And I would feel, so I do not feel comfortable with cutting the amount from that perspective at all. So I understand what you're trying to say, Will.
Yeah.
I understand that we could propose to fund 1/4 of it, which would give us time to get this in, but I cannot shake that feeling, having been in the business, been in this field, and continuing to have funding hold, not come through, and I'm very uncomfortable with the cutting. Alright,
So you're just afraid we're discussing a period. That's your fear.
I would say I've seen it happen before
But I'm
my
asking specifically.
in my career, I cannot shake that feeling of
Okay.
I can't commit money to mental health.
Okay. There's nothing in this board over the time and its history that would bear out any evidence on that. That your history outside of this is not, there is no historical action that would lend any support to that happening.
Madam Chair.
Yes, Cassie.
So we could introduce the opposite where we approve the 2.2 million, but make a commitment by the FAC to come back in December to vote on specific allocations, and that could be adjusted down or up depending on the specific priorities of the behavioral health action plan.
May I ask a question? And so
Parliamentary, is that an amendment that I have to ask for a second?
I don't,
Oh, you don't
I don't
get
have
to.
the authority to make
Sorry,
an
I'm
amendment,
just
so that's
trying to
just a
keep track.
suggestion.
Apologies.
So I'm just kind of reflecting back on my rookie meeting in June. So, I mean, if, again, I'm sure you appreciate that we also have folks that we have to answer questions to and so forth. But at the end of the day, since it sounds like the decision right actually rests within the county. So if we vote to amend this, you would have the authority to make your own decision as to what you present. Is that not correct if I'm following through with the fact that our roles are simply consultative and advisory?
So yes, this budget would be presented to the board at the recommendation of the FAC, and the county board could look at that and make another decision. That has never been done before
Right.
either. So they've always followed the recommendations of the FAC.
The FAC was just created though, right? Or-
Yes, they did follow the recommendation of the FAC last year. And for the budget amendments.
My other question was very tiny, but it just relates to the administrative overhead. Is that a formula? Is there an algorithm that translates that line item?
Yes. So would you like to describe that?
So the administrative overhead is based on work that's done by information services, the county auditor, the county treasurer, and administration. And it takes their salaries as a portion of the entire budget and then applies that percentage across the budgets of each department.
So is that administrative surcharge, is that what we're talking about? So the 32,128.
Right.
So So just to be clear, we're paying essentially an allocated expense for other positions within the county that are otherwise paid for in full by the county's own budget,
You're paying for the services they provide to that department.
but not on a time tracking tool, it's a
No.
formula.
Formula based
I
on the
would-
size of your budget.
And maybe I misspoke before, does that come from the general fund?
So it's town normal and city.
For services that are
To maintain.
utilized within the shared sales tax.
The checks that are
Right,
written for the IT support that is provided.
But I guess the formula, I mean, I guess it's what I was interested in, if it was a direct allocation for actual track services provided, or if this was simply just an algorithm that determined an allocation.
Yep.
So, okay,
And
thank
that
you.
number is based on eight? What's it based on?
Percent of salaries to total budget.
What made it go up so high then this year? The overall numbers that we were seeing in other areas weren't tracking at that percentage of increase?
If the budget is larger, then your expenses are more, then your administrative costs increase as well.
It was about an $11,000 increase from 2025.
Right, but on a percentage basis, it was significant.
Gotcha.
So I'm just trying to figure out, no other line item appeared to have moved at that trajectory. So I was just trying to connect the dots as to why that one would have moved so significantly on a percentage basis.
Well, I think expenses increased.
Yeah, and it might have been, I could see, we did increase, I'm anticipating needing some additional licensing and additional Adobe expense, so it's possible that some of those IT related costs are what increased, are what contributed to that jump.
I mean, that
Software
also
licensing
seems
agreement.
very logical, but it makes me wonder then, is it truly an algorithm, not a percentage of the overall spend?
Well, if it's
Or
an
is it
algorithm, it's
something
based
that
on-
is more,
I can
specific?
show you how it's calculated if you like.
I tell you what, I would love to, but probably not now, to respect everyone's time here, but thank you so much for offering.
That's usually coming out, general fund,
So are there any other questions about the services line for this budget?
like all mine go out of the general fund.
Okay.
Parliamentary assistance.
At this point, we need to vote on the moved and second amendment to drop it to 50,000.
Alright. Assuming there's no other,
Assuming all of the other
Yeah,
things.
so assuming there's no other discussion about the rest, cause that would be about the whole budget, so if there's anything.
Well, right now we're just,
Just the
discussing
amendment.
the amendment of the
Voting on
50,000
first.
line.
And then we vote on the budget.
That's correct.
And just again, to be clear and reiterate, this is about the articulation of a process and a timing issue as opposed to an issue of trust or anything like that, just for accountability in the future.
It also, that articulation and communication has to go to both governing bodies that you're representing, because if you pass a budget that says 50,000 in December, it becomes 2.5 million, they're gonna come apart and be at our throats, so that has to be well communicated that this is just a marker.
So to be fully transparent, our councils don't know
Well, they,
unless we tell them, because we
No.
don't, this is the first time we've seen this level of.
I know, but
So, yeah, I,
tomorrow, if it's 50,000 and on December 15th,
Yeah.
it's
no,
2.2 million,
no,
we're gonna be in worse
no,
position.
I communicate back to my leadership on budgeting and exactly what we're up to. And as processes develop, also those conversations as well. And I have a key staff member, deputy city manager, sitting right in the room, so he's also.
Talking to Chris about baseball or something.
He's well aware of this discussion. I'm sure will keep me in check if I'm going astray. Fair point.
But,
Fair point.
I mean,
Fair point.
we're both agreeing to trust each other.
Yeah. Well, I'm committed to it, and I'm the voting member. I'm committed to it. I'm gonna be back
That
here
communication will occur.
funding the mental health action plan. I'm committing to it. I'm gonna be here, and I'm the voting big number, so.
So we need to vote on the amendment as proposed to drop 0706.0002 to $50,000 from the 2.2 million.
Roll call vote, Stephanie Barish.
No.
Sheila Montney,
Yes.
Lizzie Johnston.
No.
Will Scanlon,
No.
Kevin McCarthy.
Yes.
A majority of votes is needed for a motion to pass, so the motion does not pass.
So now we vote on the budget as proposed initially.
Then there's more of the budget to go through.
Oh, I apologize.
So I didn't have any other questions on the line items other than that administrative surcharge that on that particular page.
The only other one I had was 70,000 in 706.004 for contract services. Is that-
Oh, that is rent.
Utilities and maintenance.
Yep, rent, utilities and maintenance.
Grant for what?
The space that the department uses.
So,
The use of the space in the 200 West Front Street building.
so the county department is being charged rent by the county?
For that building space, that space has many tenants, including rented space to outside entities. And any department with a special fund is charged rent utilities.
So the distinguishing,
For example, the health department is also charged
this
rent utilities.
distinguishing of who gets charged rent in a county facility is a special fund.
Correct.
Interesting. Hadn't heard that before. Alright,
So yeah, I was caution, that's not what I thought, so. Any other questions? And just again, I mean, I'm trying to learn and connect all the dots. That too would be solely paid for out of the sales tax as opposed to a proportional or prorated based on the consumption of services across the county. Is that right?
That's correct.
Thank you.
And I think it's important to keep in mind that the services funded from the shared sales tax are additional services to what the county, I mean, part of the original IGA was to supplement and to support in addition to what the county was already doing. So yes, this is a program that is funded by, that only exists because of the shared sales tax and because of the rules that we have about special funds.
So Marita's department provides no services outside of what is provided for by the shared sales tax, then am I following that correctly?
That is correct.
So no services outside of just.
so
They
I
are-
just,
There are additional services that would not exist without it.
this obviously is back to process and 10,000 foot, so just making sure that this whole department is funded by Bloomington Normal. But the county is the ultimate say of how the money gets spent.
Per the intergovernmental agreement, yes.
Okay, so I was there at the original, when this IGA was presented, I was a seated council member and took that vote. And then somehow it was presented to us. That might be how the IGA is written, and that's a discussion point for another time, but these are new revelations as we get detailed amounts that Bloomington and Normal are solely funding this entire initiative.
You're not solely funding the county's mental health initiatives.
That's not what I said. I said this initiative.
Correct, because these were meant to be additional.
That's it. So I'm just saying, it's new, I'm not arguing.
Okay.
I'm just saying, this is revelatory for us, for me. Yeah, so it's a little bit of a digestion as we are
Okay.
starting to get some detail of what's going on here. So,
Yeah, I will have to learn more because, then, our relevant interest in things like voting on staffing additions and things like that when, when we don't really have a voice in that, just have to think about what that means, so, thank you.
If there are no other parts about that portion of the budget, the other part that is also included for your review as a part of that recommendation is information related to the System of Care grant.
Do we have to vote on that?
It's
They're all
it's one section, it's at least the way that it was,
on the
it's
agenda.
at least the way that I put it in the agenda.
So they are not voting on the SOC grant. We've included that for information.
Gotcha.
Because they are voting on the matching portion of the SOC grant, which is in their transfers to other
Yes, and
funds.
same with the event, okay, yep.
So if you, in the transfers to other fund line, which is line 9990001, there's an amount of $306,423. That's a significant increase from the previous year.
Where are we talking? What page?
The page 39 paper, 40 in digital.
I'm sorry, what was the line again?
9990001 transfers to other funds. There's an amount of $306,423.
So
That is for mental health forum expenses and the Systems of Care grant match. Oh, and $1,500 for telephone expenses.
So that portion that goes into the SOC is later in that SOC budget.
It is listed separately in the other supported document.
Yes, the transfer here.
And the other organizations that are sub-grantees for the SOC grant do also contribute to the match for that federal grant.
I think
Firm concurs.
So I think that's all, I just wanted to make sure that that was understood, that the matching dollars for the SOC grant are included.
So I understand we need to vote on the budget as proposed. Roll call?
We will do roll call vote. Stephanie Barish? Yes. Sheila Motney?
Yes.
Lizzie Johnston?
Yes.
Will Scanlon?
Yes.
Kevin McCarthy?
No.
Majority of members have voted yes, the motion passes.
I will match your commitment to coming back and having conversations around the prioritization and looking at the dollars and reallocating as needed.
Gotcha.
All right.
I do hope we can have that discussion in December as we begin to clarify that crystal ball.
Agreed. So the next item is for information, it's the Behavioral Health Coordination Department report.
This is just an item for your information. I summarized departmental reports that I've brought to Executive Committee and CJCC, and most recently have been sharing with Behavioral Health Coordinating Council. Just a summary of the different departmental initiatives and projects, as well as summaries of some of the work of BHCC. I believe that the community project spending as listed is the same information that was shared at our last FAC meeting. But we are well on our way to getting the funds for the community projects spent. We just signed the contract for the EMDR training, which is up to $150,000, and as previously alluded, it's probably gonna be that because the seats are almost full. So we're well on our way to fully just spending as much as possible of that line item for 2025.
And that was in short order. It filled up so fast.
It filled up, 10 days.
Well, I will also say I got it from 5 different people.
Well, there's such a hunger for that
Yes.
training.
Yeah.
As a,
Absolutely.
that treatment.
And we specified that they needed to, these are for people who would have a reasonable expectation to be serving the Clayton County folks, so
Correct.
we're not getting
We're not training
people
other
from,
people.
yes, correct.
So our residents will be the recipients.
All right, the next item says that may which arise. Do we have anything that has arisen?
General comments, but we've fortunately covered most of them,
Yeah.
I think. I don't know if this is appropriate, if that's what that means or not. So, really the only question I have that I don't think is been addressed, fortunately, in other portions of this very long conversation is, so you talked about that fuse, the intention is to give that to a provider.
Yes, that would be our hope.
So then, do I understand that we, the behavioral health initiative would no longer be providing direct services?
Correct,
Is it
behavioral
the-
health coordination department would not be providing direct service.
Okay, is it the intention to engage and disengage, or in direct service provision, or to stay out of direct service provision?
Generally, I would
What's our plan?
probably project that we would stay out of direct service provision. I do think that the Mental Health and Public Safety Fund has given has allowed us, I don't think that would be the long-term function. If anything, I do appreciate maybe the idea of behavioral health coordination helping to coordinate pilot-like programs that would get kind of nurtured and then grown out into the community, but the intention would not be for long-term service provision, so that the focus can really be on that coordination piece.
And I would concur with that, so the county as a whole is not interested in being in direct service. In the past, this has come out of encouragement from BHCC to take on types of service in the crisis continuum that weren't available already and could not be absorbed at that time by our current service providers.
And even that pilot structure is something that could still be supported from outside of the county.
Could somebody speak to, because I don't exactly remember the transition, when we had the urgent care center, when we had did many of those staff transition to the CHS BHUC? Do we
Some,
know what
not
happened?
many.
But we didn't
Some.
retain them as staff necessarily.
Correct. Yes.
So that is not the intention once we transition this program, but I mean, one of the concerns that both of you have raised has been staffing and retention of staffing, and I think the intention is once that is gone, that those would not be our staff.
Correct, we would
I would hope
we
that
would
they would
restructure the
transition.
department.
From a trust perspective, I would hope that they would transition to the new operations for continuity of care for the clients,
They'll be competitive applicants, yes.
but yes, they
So
would.
the city and town managers had asked for a 5-year projection for costs, and Marita was able to provide that and shared that with me so that I could share it with my counterparts in the city and the town, and we gave a 5-year projection of that, which included a reduction in staff to remove the Fuse team from our roster and put that back out in the community.
I would
So that's the-
support that evolution
So that is
of
the
this
intention.
initiative, is to be coordination.
Yes. Has been heard and is
Clearly,
being
I'm not the
acted
only
on.
one.
Well,
No, you're not.
yeah, I
That
think
has
you've been the most vocal though.
Yeah.
So to that point, no, I think that you have, and I
I don't know that I've ever expressed that opinion.
I'm pretty sure that I've heard it. I've heard it in meetings.
All right.
So, to your point, I mean, trying to incorporate, just some of the feedback and the input that we are trying to tailor it to meet kind of expectations.
Mm.
And meaning getting out of service provision
All right.
has been heard.
Less rent, all sorts of stuff.
Well, as things are allowed to rise here, I would just offer but she's been very generous to help educate me. Thank you, and I just wanted to convey that I appreciate your passion on the topic and your willingness to share that with others.
Thank you.
Are we wrapping? I just,
I believe so, I was just simply going to say, do we have any public comment I need to
I don't
ask
think so.
for?
Right.
Anyone?
That would have come at the top of the hour and no, we did not.
Okay.
perfect. So I just want to appreciate, this is way longer than I was anticipating being here tonight. And, or today. I appreciate the increase in materials. Helps us to be able to get insight on what's happening and the willingness to field the questions and answers.
And now they are all located in the team, so you can actually see the whole materials as well, which I appreciate.
I did explore the team.
So do we have a motion to adjourn? All right, the whole pile just said yes. So, I think that motion passed.
Second, thirds, and fourths.
Thank you all.
Thank you.
Thank you so much.